Hi everyone, today we're doing the chapter 15 from Lippincott, which is about dietary lipid metabolism. So, what are lipids? Lipids are basically water insoluble organic compounds. So, they're water insoluble and they are organic compounds. Now, since they're water insoluble, how do they get transported in the blood? So, very important, you need to know the name of this transport protein, which is albumin. So, albumin is very common, very popular. What is its role? Its role is to transport the lipids. So, it transports the lipids. This is a very important function of albumin. So, now this should be in your fingertips that albumin helps with the transportation of lipids, and lipids, they are water insoluble organic compounds. So lipids, they're transported in blood via albumin and via other lipoproteins. Now, what are the major functions of lipids? Now, lipids, they are a major source of energy, not carbs, not protein, but lipids, because lipids, they give the maximum amount of energy. Yes, carbs and proteins are also a source of energy, but major source of energy is lipids because they have the potential to store the maximum amount of energy. Other than that, because they're insoluble in water, so they form hydrophobic barriers that helps in compartmentalization. Then other than that, lipids are also there for the absorption of um vitamins, which are fat soluble, A, D, E, and K. These are the vitamins, so it helps with their absorption. Lipids are also present in prostaglandins, and prostaglandins are again very important for inflammation and all of that functions. And lipids are also there in steroid hormones. Now, what happens if there is any sort of impaired lipid metabolism? If lipid metabolism is impaired, there are high chances of developing diabetes, obesity, and atherosclerosis. So this is the clinical relevance that impaired lipid metabolism can lead to diabetes, obesity, and atherosclerosis. Now, we normally take in lipids, obviously, in our diet. Now, what do we mean by that? That these are dietary lipids. So how, like what sort of dietary lipids is there? You have tags. So the 90% of lipids that you take in orally that consists of tags, which are triacylglycerides tags. And then the remaining 10% are these four, which consists of cholesterol, cholesterol esters, phospholipids, and non-esterified fatty acid. Non-esterified fatty acid is also known as free fatty acids. So non-esterified fatty acid. So tags, cholesterol, cholesterol esters, phospholipids, and non-esterified fatty acids. These are dietary lipids. The greatest chunk of dietary lipids constitutes of the tags. Now, before we further move on to digestion of lipids and their metabolism, it's very important for us to talk about this disease, which is cystic fibrosis. Cystic fibrosis is an autosomal recessive disorder and it's a genetic disorder. Now, why does it develop? It develops because of the mutations in the CFTR gene. CFTR gene, this stands for cystic fibrosis transmembrane conductance regulator gene. So CF transmembrane conductance regulator gene. So cystic fibrosis transmembrane conductance regulator gene. Now, this gene codes for a chloride channel, which is a special channel. Now, this chloride channel, it helps with the secretion of chloride. But because there is a mutation in this gene, chloride channels won't be made. Therefore, there will be decreased secretion of chloride. And because there's decreased secretion of chloride, and there's increased uptake of water and sodium. Because of this, the mucus will be thickened. Why? Because there's decreased secretion of chloride. Chloride is not being secreted, it's stored inside only in the mucus. And other than that, there is in fact increased uptake of sodium and water. So this will cause increased uptake of sodium and water, which means that sodium and water is being uptaken, right? So there'll be thickened mucus. Now, this mucus is really dangerous. Why? How can it affect us? It can affect four of our organs. One is pancreas, the other is lungs, testes, and sweat glands. Now, what happens is that in pancreas and it can cause pancreatic sufficiency because it's going to block the pancreatic duct. And what does pancreatic duct do? It releases the enzymes into the stomach. So pancreatic enzymes into the small intestine, sorry. So pancreatic enzymes will be unable to reach the small intestine, and therefore the digestion will be very poor. So that's the reason that your cystic fibrosis can cause pancreatic insufficiency. What's the treatment for pancreatic insufficiency? So you need to replace the enzymes, for example, whatever pancreatic enzymes are there that would have otherwise helped with the digestion, you need to replace them. And other thing is that you need to supplement with the fat soluble vitamins, because these fat soluble vitamins, they are unable to be absorbed because there's no because of the blockage. Uh, Lipid is not being absorbed, and because lipid is not being absorbed, fat soluble vitamins are also not being absorbed, so you need to supplement with fat soluble vitamins. Now, yes, here they're saying that in pancreatic insufficiency, the pancreas cannot release enough pancreatic lipase enzyme required to digest dietary fats. So because the pancreas, they're not releasing enough pancreatic lipase enzyme, dietary fats are not being absorbed. And because dietary fats are not being digested, they cannot form vessels and they cannot be absorbed. And then fat soluble vitamins A, D, E, K, they require normal fat digestion and muscle formation for absorption. They're also poorly absorbed, leading to deficiency. So because fat is not being absorbed because of pancreatic insufficiency, there's very less of pancreatic lipase. So fat is not being absorbed. So if fat is not being absorbed, so obviously vitamins will also not be absorbed. Therefore, supplementation is needed because fat malabsorption automatically causes fat soluble vitamin malabsorption. So you need to also supplement with the fat soluble vitamins, and obviously you need to replace the enzymes. So now we're talking about cystic fibrosis here. These may cause repeated bouts of an inflamed pancreas called pancreatitis, infertility, and repeated bouts of pneumonia. So I told you it affects your lungs, it affects your pancreas, pancreatic insufficiency. In lungs, it can cause pneumonia. In testes, it can cause infertility. And we also spoke about sweat glands. And also, normally in babies, when parents are kissing their children, they can make out that there's excessive or unusual amount of salt in their sweat. So that's how even you can see that this is one of the common features or symptoms of the cystic fibrosis. So pancreatitis could be one, pancreatic insufficiency, and then infertility, and then pneumonia, frequent pneumonia, and then excessive sweat and salt in the sweat. The respiratory symptoms, why do they arise? Obviously, because that thick and sticky mucus is going to clog the tubes that carry air in and out of the lungs. Because of this, there'll be a lot of coughing in the children or even in the adults. There'll be squeaking sound, wheezing, there'll be lung infections, there'll be irritated and swollen nasal passages, there'll be sinus infections. So these are the respiratory symptoms. And what are the, and this is because of, and this is obviously because lungs are blocked, so it will have the respiratory symptoms. And also there'll be pneumonia. And because the digestive, because pancreatic what do you call it, pancreatic insufficiency is there, because the pancreatic duct is blocked, so there'll be pancreatic insufficiency and there'll be digestive symptoms. So the digestive enzymes will be blocked. Without these digestive enzymes, they cannot be released into the intestines from the pancreas. The intestines can't completely take in and use the nutrients in the food, and the fat will not be absorbed. Fat is not absorbed, ultimately vitamins won't also be absorbed. This will result in foul smelling greasy stools, right? So this is very important that foul smelling greasy stools will be there. There'll be poor weight gain and growth. There'll be blocked intestines, and there'll be constipation, and there'll be rectal prolapse, because obviously that person will be sitting and trying very hard, and they'll be sitting on the commode or in the toilet trying very hard and straining in order to pass the stool, and they'll be unable to do that. So as a result of constipation, they'll also develop rectal prolapse. So this is about your cystic fibrosis. Now moving forward,